Nigeria, we want to warmly welcome us to today's national briefing. Today is Tuesday, 6th of April, 2021. The Chairman, PTF, and the Secretary to the Government of the Federation, Honorable Ministers and members of PTF. Sir, we have in our midst the Acting Indian High Commissioner to Nigeria, Velagati Surendra. You're welcome, sir. Our dear viewer at home and our listener, colleagues covering this event live and those at various remote locations, once again, we say welcome to the PTF National Briefing for today. We want to go straight to our program. The usual format will be maintained. Please permit me at this point in time to respectfully invite the Chairman of PTF and the Secretary to the Government of the Federation to the podium. Good evening, sir.
Distinguished members of the Presidential Task Force, Your Excellency, the Acting High Commissioner of India to Nigeria, members of the Diplomatic Corps, distinguished ladies and gentlemen, gentlemen of the press, let me start by wishing you a belated Happy Easter and pray that you had a wonderful celebration with caution, and also to apologize for starting this briefing late, particularly to our distinguished visitors from the Indian High Commission. I welcome you to the national briefing by the Presidential Task Force on COVID-19 for today, Tuesday, the 6th of April 2021. The PTF could not brief the nation earlier than this time because of the end of term review meeting held with partners and other stakeholders and the just concluded Easter celebration. I use this opportunity to welcome everyone back from the Easter break and do hope that we all kept to the public health measures during the festivities. You will recall that when His Excellency Mr. President received the end-of-year report on the PTF on December 22nd, 2020, he authorized the extension of the mandate of the body for 3 months. Following expiration of the extension on 31st March 2021, and the detailed review, the PTF submitted its report to Mr. President for appropriate decisions. The extension by Mr. President has enabled the PTF to vigorously pursue the twin objectives of epidemic control through reduced transmission and minimizing mortality among vulnerable and infected citizens. You will recall that the timeline between November 2020 through February 2021 coincided with a virulent second wave, during which the country experienced the most challenging phase of our national response. The daily number of cases, fatalities, and the level of non-compliance with public health measures were all very high. I am pleased to inform you that in addition to already recorded accomplishments contained in the end-of-term report, the PTF, with your collaboration and support, also achieved the following during the 3 months under review. 1, complete digitalization of the National Disease Surveillance System and establishment of a new management standard for infectious diseases treatment centers across the states. 2, safe reopening of schools and restart of economic activities. 3, initiation of a COVID-19 vaccine rollout program and the development of a strategy for assessing vaccines and ensuring their deployment to the last mile. 4, signing of the COVID-19 Health Protection Regulations 2021 by Mr. President in January, and subsequent enforcement activities that have contributed to increase adherence to public health and social measures. Coordination among MDAs for effective service delivery. 6, increased risk communication activities to address vaccination hesitancy and the MPIs. 7, ramping up testing at the local government authority level. And 8, initiating the transition of the international travel portal to the NCDC platform. And 9, setting up of a result verification portal for all COVID-19 PCR travel tests to minimize the reputational damage due to the presentation of fake PCR results by Nigerians at points of exit. For the record, several factors accounted for the successes recorded by the PTF, despite the several challenges encountered. These factors include: 1, effective multi-sectoral coordination, reliance on science and data to take informed decisions, development of systems and processes for tracking of cases, prompt dictation and reporting, expansion of laboratory network, strengthening national laboratory supply chain, expansion of biosafety and biosecurity practice within the network of labs, support for the first SARS-CoV-2 seroprevalence survey in Nigeria, support for the whole genome sequencing of SARS-CoV-2 virus, focus at identification of circulating variants, surveillance of inbound travelers, successful integration of antigen-based rapid diagnostic kits into the SARS-CoV-2 testing regime, strengthened health security through further inclusion and involvement of private laboratories in the public health response, development and review of protocols and guidelines, enhanced COVID-19 entry screening for travelers at point of entry, regular issuance of COVID-19 related regulatory guidelines, and all operators latest to aviation industry operators. Socio-economic interventions, particularly the Economic Sustainability Plan, strengthened and increased market access, facilitation for targeted women and youth SMEs, identification and expansion of the social investment programs, sustained communication between PTF and the governors, institution of transparency, trust and prudence in financial and resource management, building partnerships with the private sector and international bodies, and reviving existing oxygen plants, construction of new ones across the 36 states and the Federal Capital Territory. Perhaps the most significant development in the global response to the pandemic was the arrival of vaccines in record time. The global achievement in scientific research and development brought hope to humanity. The World Health Organization granted emergency use license to 3 vaccines: Pfizer, BioNTech, Oxford, AstraZeneca, and the Johnson & Johnson. There are about 10 other vaccines that have been granted emergency use approval by national regulatory authorities, and more than 80 vaccine candidates in development. Additionally, 2 antigen-based rapid diagnostic test kits have been approved for use by the World Health Organization. As you are aware, Nigeria received 3.92 million doses of the COVID-19 Oxford AstraZeneca vaccine on 2nd March 2021. These vaccines represented the first tranche of about 60 million doses allocated to Nigeria through the COVAX facility, aimed at vaccinating an initial 20% of the population. More vaccines are also expected from the African Union's Vaccine Acquisition Task Team, AVAT. During this briefing, we shall also be receiving about 100,000 doses of Covishield vaccines donated by the government of India to Nigeria, and we remain eternally grateful for that. This will further boost the number of Nigerians to be vaccinated by about 50,000 persons. The Presidential Task Force, through the Federal Ministry of Health and the National Primary Healthcare Development Agency, prioritized the initial consignment of the vaccines to cover frontline medical personnel, strategic leadership, and those above the age of 50 years across the nation. Majority of subnational entities have already received their allocation, and administration is progressing. As at April 5th, 2021, 963,802 persons in Nigeria had received the first dose of the COVID-19 vaccine. The overarching objective is to vaccinate 70% of Nigeria's population between 2021 and 2022. Ladies and gentlemen, the global hope offered by the arrival of vaccine has, however, been threatened by the detection of variants of concern as described by the World Health Organization, and that's the B.1.1.7, the B.1.3.5.1, and the P.1. These variants are associated with increase in spread of the virus, transmissibility, and account for the third wave of infections currently occurring in Germany, France, United Kingdom, Brazil, and a host of other countries. There is some evidence that existing vaccines are less effective against the variants. While the research is ongoing, looking at the impact of variants of concern on the global situation, Nigeria has remained very vigilant in this regard and shall continue to apply science and data to navigate this dangerous terrain. On domestic and global challenges impacting on the hope offered by the vaccine include the following: global vaccine nationalism that is on the grow, demand for exceeding production capacity of manufacturers, which is threatening delivery and access to schedules, domestic vaccine hesitancy and elite resistance, and fourthly, diminished level of trust between citizens and government. While the international challenges are being addressed through direct diplomatic, global and regional bodies, the PTF has been engaging actively with subnational entities, traditional rulers, faith-based leaders and organizations, and other critical stakeholders through partnerships to, one, promote ownership of the response, escalate risk communication and community engagement, three, minimize fake news and misinformation, and fourthly, minimize vaccine hesitancy and elite resistance. I informed you at the beginning of my remarks that the PTF had submitted its report to Mr. President, preparatory to the expiration of the 3-month mandate extension granted to the PTF. As part of the process that fed into the report to Mr. President by the PTF, we consulted widely with partners and stakeholders. We reviewed the ongoing operations aimed at controlling the epidemic. We evaluated the strategy for procurement and delivery of vaccines and its challenges. We held a one-day end-term review meeting involving the National Assembly, development partners, technical and financial experts. And we recognized the need to sharpen the focus of the response after 1 year in a manner that will sustain the gains made, prepare the nation for any future outbreak, and make progress in the post-PTF era. These areas of focus include: 1, coordination of the vaccine program alongside compliance with the public health measures, building greater collaboration with subnational entities, and 3, building partnership for resource mobilization. 4, instituting far-reaching reform of the health systems and pursue ongoing infrastructure development program in the health sector to a logical conclusion. 5, promoting risk communication, community engagement, and case management while paying attention to public health interventions. 6, building on the invaluable gains of the multi-sectoral approach to governance. And lastly, 7, continue reliance on data and science to take informed decisions. Mr. President has considered the report and has approved the following. 1, that the PTF would transition to a presidential steering committee on COVID-19 effective from 1st April 2021 with a modified mandate to reflect the non-emergent status of COVID-19 as a potentially long-term pandemic. 2, that the structure of the Presidential Steering Committee shall reflect the new focus of the response with a targeted approach on vaccine oversight, risk communication, international travel quarantine processes, and subnational engagement. And 3, that the tenure of the Presidential Steering Committee shall last till December 31st, 2021. The Presidential Steering Committee would maintain the present constitution, functions, and strategies of the PTF, be supported by a slim technical and administrative structure. The current National Incident Manager, Dr. Mukhtar Mohammed, shall formally take over from the National Coordinator, Dr. Sani Aliu, and function as the head technical secretariat and member of the PSC. A policy leadership secretariat from the Office of the Secretary to the Government will sustain institutional memory and records. A private sector supported transition consultant that will sustain the multi-sectoral relationship and policy guidance. Coordinate the vaccine rollout, deployment, and administration. Improve on the multi-sectoral systems. Meet less frequently while maintaining effective communication with Nigerians. As a matter of fact, we intend to start meeting only 2 times a month, and we will graduate to just 1 meeting every month. Monitor and audit ongoing systems, reforms, and infrastructure development in the health sector. As we close this phase of the national response, the Presidential Task Force wishes to express its profound gratitude to every individual and organizations that played a part in the national response. It has not been an easy journey, but your companionship and support help us forge ahead and accomplish these modest successes. Given the developments around the world, we must recognize the fact that the next phase will be challenging, critical, and will require extreme vigilance and collaboration. Today is an appropriate time to appreciate all our benefactors in this national response. While I cannot list everyone, mention must, however, be made of the gallant and heroic print and electronic media personnel, frontline health workers or personnel, security forces, development partners, international community, religious, traditional, and community leaders, the youth and the labor leaders and organizations. Special mention must also be made of the Bill and Melinda Gates Foundation, the Dangote Foundation, for supporting the secretariat functions, the organized private sector COVID, the CBN, the NNPC and partners, the Nigerian Sovereign Investment Agency, armed partner security services, state governments, the National Assembly and its leadership, and numerous individuals and corporate bodies that sacrifice for the good of humanity. I particularly wish to thank the National Intelligence Agency that released its prime facility on the campus, which served as the base of the PTF for more than a year. On a personal note, I would also like to thank the outgoing National Coordinator, Dr. Sani Aliu, for his commitment and effective leadership of the technical team in the last 1 year. Last week, he took out time from his busy schedule in the Oxford University to come and spend a week with us, meeting as we prepared the end of term report. He left his family, his primary duties in the United Kingdom to take up a unique national call and has performed in an exemplary manner. And my colleagues on the Presidential Task Force, the honorable ministers, that in spite of your various engagements and commitments and your primary responsibilities as ministers of your ministries, charged with the responsibility of delivering on the 9 priority mandates of government. In spite of that, you've committed yourself to this work in the last year plus. And you continue to do it until we get over this current surge of the COVID-19 pandemic. I express a heart of gratitude for all the support and cooperation that I received from you as the chairman of the Presidential Task Force. While we cannot thank all our partners enough, I need to reiterate that humanity is not yet out of the woods. We need to stand firm against vaccine hesitancy, fake news, vaccine nationalism, and all such challenges blocking the achievement of overcoming the pandemic. Remember, nobody is safe until everyone is safe. Finally, as we turn and return to work after the Easter break, we urge everyone to be vigilant, stay safe, observe basic health measures, even if you have received your first dose of the vaccine, and take full responsibility for your life, for those of your loved ones, and for the community. The second year of COVID-19 national response will be as challenging as the first. If experiences of countries that have virtually vaccinated their countries or their citizens or a substantial percentage of their population is anything to go by, we are still in the midst of these critical challenges. We cannot afford to rest on our oars, but to do everything for the sake of humanity to turn the curve and end this pandemic in a very, very quick manner so that we can begin to return to what is perceived as normal life. I thank you all for your kind attention and for listening, and I wish you a very pleasant evening. Thank you.
Thanks so much. It's been quite lively. The hall was quiet and
Mr. Boss Mustafa, honorable ministers and members of the PTF, all protocols duly observed, ladies and gentlemen. A consignment of 100,000 doses of Covishield vaccines has been donated by the Government of India to Nigeria. These 100,000 doses of vaccines manufactured at the Serum Institute of India, Pune, the world's largest manufacturing facility, arrived at the Abuja airport from Mumbai via Addis Ababa on 26 March 2021 at 1200 hours. The consignment was delivered to the National Primary Health Care Development Agency, NPHCDA, by the High Commission of India. The Covishield vaccine manufactured at the Serum Institute of India is the first COVID-19 vaccine approved by NAFDAC Nigeria. Its first lot of 3.92 million doses of vaccines under COVAX had reached Nigeria on 2nd March 2021. The bilateral donation of 100,000 doses of Covishield vaccines is in fulfillment of the announcement made by the High Commissioner of India at that time. On the occasion, High Commissioner Abhay Thakur stated that the supply of vaccines to Nigeria is in keeping with Prime Minister Narendra Modi's commitment made at the UNGA in September 2020 that India's vaccine production and delivery capacity will be used to help humanity in fighting COVID-19. He added that these supplies of made-in-India vaccines in Nigeria is in keeping with India's long-standing, age-old, and time-tested ties with Nigeria based on close friendship and deep mutual trust. India has been at the forefront of the global fight against the pandemic and supports a collective approach in this battle. Guided by this philosophy and as the pharmacy of the world and under the Vaccine Maitri initiative, Maitri means friendship, has supplied millions of doses of vaccines to many countries spread across the globe. As on 2nd April 2021, India had supplied 61.42 million doses of made-in-India vaccines to more than 82 countries and will be supplying to more countries soon. Despite the supply shortages, and at a time when the 1.3 billion population of India itself has been administered only about 55 million vaccines so far, and when about 3 million daily vaccinations are taking place in India, its own needs are huge, and India is still supplying vaccines across the world far and wide. Nearly 36.5% of all vaccines supplied to the world as of mid-March were made in India. India is not only a leading producer of AstraZeneca vaccines and would also produce other vaccines such as Novavax and Sputnik, but has also developed its own indigenous vaccines called Covaxin, manufactured by Bharat Biotech, which too is highly effective and has been supplied to many countries. We look forward to NAFDAC approval for Covaxin in due course and its supply to African countries, both bilaterally and under various international arrangements such as COVAX and AVAT. As the Honorable Minister of External Affairs of India, Dr. S. Jaishankar stated in the Parliament on 17 March 2021, Vaccine Maitri began in India's immediate neighborhood, followed by our extended neighborhood, including the Gulf countries, and then immediately to needy and vulnerable nations in Africa and the Americas. Dr. Jaishankar had further stated that as Indians, we are all naturally internationalist by virtue of our culture, traditions, heritage, and history. We have never seen a contradiction between the internationalism and the nationalism that was the driver of our independence movement and the subsequent efforts at our nation building. Indeed, this experience has even further reinforced our internationalism by creating a strong solidarity with other nations who have similarly struggled for their freedom. In recent years, as democracy struck deep roots, we have found our own cultural expressions that define us in a diverse world. In fact, drawing from that heritage, we have become even stronger voices of international cooperation and stability. This is, of course, in great demand at times of stress like the COVID pandemic. Thank you so much.
You now have the privilege of inviting the chairman of PTF for the presentation, please. The chairman.
PTF. My name is Mitaire Ikpe and I report for the NTA. As the PTF transitions to the PSC, I want to ask what is the fate of workers from grade level 12 and below that are still at home? And also, I want to know if those who have taken the AstraZeneca vaccine can still take the Johnson & Johnson vaccine when they arrive. Thank you.
My name is Abbas Adebawale Jimoh from Daily Trust. This is directed to the chairman. There are incidences of Nigerians complaining of side effects of the first doses of the vaccines. And they want the government to give an assurance on their fate, especially that some of these cases were confirmed, but there was no official proclamation on their cases. Secondly, Nigerians were asking if some members of the PTF here, especially the media, have not taken their first doses. How sure that the remaining Nigerians will have this? The third one, also for the chairman, there was a case of Argentine president and some other cases that were reported, which also tested positive after receiving the first doses of the Oxford AstraZeneca. So what is the reaction of the PTF, now PSC, to this? Thank you.
Farouk, I report for Liberty Radio and Television. Mr. Chairman, earlier in your remarks, you said this PSC will be meeting less frequently while maintaining effective communication with Nigerians. I want to know what will happen to the national briefing. Yes, what will happen? To the Minister of Health, there are reports that Ministry of Health has directed some states to stop vaccinating as they finish the first dose, so that there will be remaining jabs or dose for the second dose. How true is this report?
Good evening, the News Agency of Nigeria. Mr. Chairman, going by your speech, the issue on vaccine rollout is kind of silent, and the indecision and uncertainty at the moment of us having vaccine, we don't know what's next. Now that we're moving from emergency to endemicity, what next? What should our guideline be like? That's for you. My next question is for the WHO. I said, now that we are moving from emergency to endemicity, what will our guidelines be? What would our guidelines be? My next question is for the WHO representative. Yeah. Nigeria will be joining the world to celebrate the World Health Day tomorrow. How will you describe the Nigerian health sector at the moment? WASH in a health facility, and how will you be advising the chairman of the presidential task force on how all Nigerians can access quality healthcare in everywhere and in every place, in every community in Nigeria? Thank you very much.
AK from Channels TV. My question is to the NCDC boss. European Medical Agency found reasons to believe there is causal link between the vaccine and blood clots. I don't know if investigations are ongoing within the country to verify this report. Thank you.
Of the Presidential Task Force and my colleagues and media representatives here present, of course, I recognize the acting Indian High Commissioner to Nigeria, and thanks for your gift show of love. Thank you very much. I think the only question directed to me is a question from Farouk. I hope I got that name right. I just wanting to know whether it is true that directives have been given to the states to vaccinate half of the doses deployed to the states. That is true. We believe that in a situation where we still cannot specifically determine when the next batch of AstraZeneca vaccines will arrive, then I think wisdom only dictates that it's better for us to vaccinate people fully, and so that we can say that we have a pool of citizens that have been fully vaccinated, since this vaccination comes in 2 doses. So that's what gave rise to that directive. Rather than just going ahead with just single dose, when the full dose should be 2 doses of the vaccine. So I think we felt that it was proper for us in the circumstance to ensure that those who have been vaccinated have been fully vaccinated. I mean, by the time we fully utilize the doses available. Thank you very much.
Gentlemen, ladies, thank you very much. So there's been ongoing investigations that we've all been following on a link between, or suspected link between the the AstraZeneca vaccine to certain very rare incidents of blood clotting in individuals in Europe. Now, those investigations are still ongoing, right? Certain EMA has made certain comments. Certain countries, not all European countries, have taken certain actions within their populations. In Nigeria, with every vaccine, we have a parallel system to measure and to monitor any side effects. That is ongoing. It's being managed by NAFDAC in collaboration with MPACDA. And we will continue to monitor patients in Nigeria. You know, every demographic is different. The demography taking vaccines in every country is different. The interactions between different drugs people are taking. So there are many circumstances that need to be fully evaluated. We will look at the data ourselves here in Nigeria, and we'll take action as needed. I think the critical thing to always remember when you talk about medicines, vaccines, and side effects is it's never as simple as it imagines. You always have to weigh the risk versus the benefits. And once you do that, it becomes immediately obvious that the benefits of these vaccines by far outweigh small risks in individuals. The argument against that is always, if it's in one person, the risk in that person is 100%, whether the rest of the population gets it or not, which is true. Which is why we're obliged to investigate every case that we see and do the best that we can to understand what is going on. So I think what Nigerians can do really is to rest assured that as we increase the scale of the vaccination program, we are also monitoring very carefully, not only that, but other potential side effects in our context in order to make the best decisions for our people. So, Gloria, I think for now, we can be sure that we have an effective vaccination program going on, and that we're very responsive to the concerns of Nigerians and will respond to them as appropriate. Thank you.
The vaccines. So there was a question from NTA whether it's possible to take the AstraZeneca and the Johnson & Johnson. I mean, that is a no, right? You cannot take the AstraZeneca on your left and then Johnson & Johnson on the right. Yeah, so it has to be both doses of AstraZeneca and a single shot of the Johnson & Johnson. So there was a question from Daily Trust. I think it was Abbas that asked about the reported side effects of the AstraZeneca. I think we've said on multiple occasions here that there are side effects of these vaccines. Side effects of vaccines are not unique to the COVID-19 vaccines. And it is not uncommon for people who take the vaccine to experience mild side effects. Once they experience these side effects, the correct thing to do is to report these side effects to the health facility where you got the vaccine. There's also the Med Safety app that you can download on your phone and report these side effects. The data goes directly to NAFDAC, and we're following up on these side effects. Anywhere there's a serious side effect, this is investigated to try and establish any causal link between the vaccine and whatever symptoms or sign the client has shown. So one thing that we continue to tell our vaccinators is that even before people take the vaccines, they should be educated on the potential side effects. For those of you who have kids, when you take your kids to the health facility for vaccination, I'm sure you're familiar with the fact that on that day, the kid, you will usually have a mild fever, they might not be able to raise that limb, and they're usually very irritable. These are evidences that the vaccine is actually working. So there is an immune response to the vaccine that has been introduced into the body. Then you asked about some members of the media that have not taken their first doses. I believe that is the question. So I think we're at the point where we're still vaccinating. The media practitioners like you are regarded as frontline, and I'm sure that eventually you'll get the opportunity to take the first dose of the vaccines. All you have to do, of course, is to sign up or go to the nearest designated health facility, and we have provided information to them that journalists are frontline workers and they should be given the vaccines as well. What the states have done for the most part is to set aside the vaccines that will be reserved for the frontline health workers who are the highest in terms of priority listing. So Rachel talked about the uncertainty around the supply of the vaccine, and Rachel, I'm actually not very clear about what you're... Okay, it's for the chairman, eh? Okay, thank you. Right, what we're doing is just changing the structure in response to the epidemiology of the virus. But the PTF will continue to engage with our partners and our donors to get vaccines for Nigerians. That commitment will not change, okay? And in his speech, the chairman actually mentioned the fact that we'll continue to work as part of the steering committee, only that more responsibility is being devolved to the agencies as part of the long-term sustainability plan, right? So what the PTF is doing is to make sure that whatever is the mandate, the roles of the institutions, they continue to drive it, right? Because in the end, it is the institutions, the agencies, the ministries that will be responsible for long-term sustainability of the work that the PTF is doing around multi-sectorial coordination. So that is the easier part of the question that I have answered. It's a no-no for you to try and combine two different vaccines, or to take a second type of vaccine after you've taken the AstraZeneca. There's no need for you to take the Johnson & Johnson or the Pfizer. Second of all, the efficacy of the vaccines is not a parameter that has arisen as a result of head-to-head comparison, right? So there's a different clinical trial that was conducted for the AstraZeneca and a completely different trial. Different individuals were used, right? So what the efficacy is talking about is in relation to the particular trial that was conducted. In any case, the AstraZeneca vaccine can go close to 90% in terms of its efficacy, depending on the interval between the first and the second doses. So if it's in terms of even the numbers, the number for AstraZeneca is better in terms of efficacy, if that is what you are looking at, right? The Johnson & Johnson is rated to be around 66%, but after the first dose of AstraZeneca, you can get up to 76%. There are some studies that have shown, some clinical trials, and then it approaches up to 90%, after the second dose is taken 12 weeks apart, right? So it's not an issue of comparison. Pfizer is 95% and AstraZeneca is 76%. That is not how the efficacy works. I can share more details with you after this briefing. Thank you very much.
The health sector. Yes, tomorrow is World Health Day, the 7th, and on this WHO calls you and I to play our part in building a fairer and healthier world. Now, you did ask a good question about our opinion as the World Health Organization on Nigeria's health sector. I must really say significant progress has been made. However, there is more to be made, especially around areas of equity. Whereas access has been built over time, we still have quite a lot more to do in our strive to achieve universal health coverage. You will realize from the demographic and health survey that there are certain disparities in access, for example, to health care, where we see higher quintiles, wealth quintiles, accessing more than the poorer ones. And it is areas such as that we call upon all stakeholders, you and myself inclusive, in reducing that. Certainly, a lot has been done. For example, we know that with the resilient health system, polio was kicked out of Nigeria. I think that's something to be proud about as a country. And we remain committed as the World Health Organization that as we move along this journey, we will move with you, with the government, hand in hand to achieve universal health coverage. Thank you.
Thank you.
Thank you, Basi. The first question I want to deal with is the issue of grade level 12 and below, what we're going to do with that. We've discussed it quite elaborately this afternoon, and there were certain considerations that we want to interrogate further because there are some few red signals that we must deal with before we would communicate to the head of service of the Federation as to when is the appropriate time for them to return. So we are still drilling the issue, and within the next couple of weeks, when we come to a conclusion about the safety of a full-blown opening, it comes with its own challenges. A full-blown opening in public offices and also private concerns. For the private organizations, they have come to appreciate the fact that there is a new normal, and a lot of people are being asked, if you follow the news across the world, across the globe, there is a new way of doing things. The big establishments are even shutting down their offices because they've realized that people are even more productive working from their homes. We are getting there gradually. Before we take a decision as to when level 12 and below will return to work, we will drill in some few issues and have a clarity of where we are in terms of our control, in terms of our vaccination, so that we do not blow the level of successes that have been achieved thus far. But they will return when we have a clarity as to the way to go. Side effects. I don't know of any vaccine that doesn't have side effects. There is no vaccine. For those of us that were born in the 50s and the 60s, if we roll our sleeves, you will see marks. You will see marks. As a matter of fact, in those days, when you take vaccine, it was a 1 week sickness. You will be nursing a wound. If I roll my sleeves now, you will see spots. And I think Tajuddin too will show me spots. of vaccines that we took, all manners of vaccines. So to assume that vaccines will be taken without side effects, I think that's, it's an expectation that I think does not come with the corresponding reality of how vaccines work. For the medical people, they know exactly what are the contents of those vaccines and how they are supposed to respond. I took mine. As a matter of fact, I had to ask the lady, have you finished? Because I didn't even feel when the needle penetrated my body and she released the dose. I didn't. I had to ask her, have you finished? But people's chemistry are different. Our metabolism are different, so people will react differently to vaccines. To assume that there is any vaccine without side effects, that would be far-fetched. The question with regards to media has been taken as to whether the media personnel that have not received, whether they will be able to receive. We expect that you will be able to receive because you are considered front line workers in this particular enterprise. You have mingled with us in the last 1 year. You've been exposed when people were hiding in their homes because of COVID. You are exposed. You had to come out to work on a daily basis. So we should do all that we can. But I understand that the primary healthcare had phased out the administration of the vaccine. The first phase with a definite population expected to be vaccinated. The second phase has, the third phase has, and the fourth phase has. We might be challenged with the supply, and it's not only Nigeria, it's all over the world. As a matter of fact, I'm a little bit apprehensive if countries will not fight over vaccine supplies. The way they are going, there will be litigations, there will be big quarrels because of the heightened nature of vaccine nationalism that you see all over the place. Even where you want to source, you have paid for, a region can decide we are not exporting any vaccines out of our territory. And it will definitely affect supplies because vaccines are not manufactured in every country. There are some countries that have built up their capacity. We are hoping that after this pandemic, we should have ramped up our capacity to be able to manufacture basic vaccines. Believe you me, for those of us that were born in the 50s and 60s, we used to take vaccines manufactured in Nigeria. We used to take vaccines manufactured in Nigeria. So you can see what has happened to us as a nation. If we had sustained those processes, both vaccines for human beings and animals, I know those of animals used to come out of Vom and Zaria. For human beings, used to come out of Yaba, has stand to be corrected by the medical experts. There were plants that were manufacturing the basic vaccines that we needed. After several decades, we've totally ignored those infrastructure developments, and that's why we are battling with this. And I believe, as I've said often, that COVID-19 came with its challenges, but it has also provided us as a country with opportunities. And we must recalibrate and reconstruct the health infrastructure of this country. If we miss this opportunity, I've told the Minister of Health and the two Ministers of Health, I said, you either seize the opportunity now and really redefine the health sector and the health security system, or by next year, nobody will talk about you again. Because there will be other contending demands as per legacy projects for this government, where the resources will be deployed. Now you have an advantage. And because of the nature of our response, never in the history of Nigeria have we ever had this strong partnership between the corporate world or the private world and the public system. That we were able to pool resources together and manage it at a multi-sectoral level and created a response that is being applauded across the globe as having worked. So I think we can borrow from that and really work on recreating our health infrastructure. Liberty, whether now that we are transiting from PTF to the Presidential Steering Committee, basically what we are doing is because the PTF was a task force that had to act on a day-to-day basis because of the emergent nature of the COVID-19 pandemic. Now that we've gotten to this stage, we are trying to build capacity, we are trying to empower our people, we are trying to make sure that there is sustainability in our health infrastructure. The PTF is kind of not going away, but saying, okay, there are areas of specific focus. Let's concentrate on those areas of specific focus. If we had promised to build 38 oxygen plants across the nation, let's ensure that they are built. If we have promised to have at least a 10-bedded ICU provision in each of the states of the Federation, where is the location? Has it been done? If it has not been done, when will it be done? Where are the resources coming from? So these are the kind of things that the PTF will now begin to look at, so that at the end of the day, by the time the pandemic is all over, and we are able to ramp up our vaccination and we get to the point of herd immunity by vaccinating about 70% of our population, we can step back and say, okay, these were the things that we had put in place, and we have achieved on each and every one of it. Trust me, there will be future pandemics. Do we have to start building the infrastructure afresh again? We should prepare our people. When we started, there were just about 3 PCR molecular laboratories. Today, we have in excess of 100 plus. We have built infrastructure. So if there's any kind of outbreak again, we will not be running helter-skelter looking for where to test. The infrastructure has already been in place. So these are the kind of things that we would be putting a lot of our efforts and a lot of our resources, our thinking cap, to ensure that at the end of this entire exercise, like I keep saying, we will leave a handbook. When I was appointed along with my colleagues, it was a 1-page letter with everybody's name on it. The terms of reference is that you would operate in 6 months. That was all I got. But we have crafted a response today that is the envy of a lot of countries. And we will leave a playbook. We will leave something that whoever comes after us will pick it when there is any pandemic. At least if it does not fit into REACH stereotype, they will be able to pick 1 or 2 things and work with it so that the emergent nature of any pandemic would not create the kind of panic and confusion that we suffered. This COVID war, it has taught me a lot of lessons. It has exposed the weaknesses of our system. As a matter of fact, I've seen presidents of nations abdicate responsibility because of COVID. Abdicate responsibilities. I've seen governments virtually in total confusion because of COVID. So it's a very, very serious business. Emergency versus pandemicity. Rachel, this thing is simple. Get vaccinated, continue to wear your mask, continue to observe the non-pharmaceutical interventions. Vaccination will not protect you against infection. It only creates immunity so that you don't fall terribly ill. It's an immune system. If you get vaccinated and get careless, as a matter of fact, the most virulent of the variants or strains can deal decisively with any person. And what is the process we are going to leave in place? Transiting from PTF to PSC is just in the context of what we will be focusing in. When we started, because it was a task force, you remember we were meeting here virtually every day. Then we began to reduce the numbers of meetings until we got to where we are today. Now, as a Presidential Steering Committee, we are saying that we would allow the MDAs take ownership of what has been in place and what is going to be in place, so that capacity can be built, it will be sustainable, and ownership will be transferred to each of the MDAs as part to the areas of their intervention. So the transition will not create any gap, because the PTF and its membership transiting to Presidential Steering Committee does not reduce the oversight. We will still continue to oversight. We will not be operational like we have been in the past, because the PTF was both a policy and an operational arm. So everything that you think we have been doing in the past will be transferred. We will retain some oversight. We will continue to brief the nation. We would ask the agencies to intensify their briefing of the nations. The Primary Healthcare Development Agency doesn't have to wait until our meeting for him to speak to the nation on the status of vaccination. The DG NCDC would not have to wait for our national briefing for him to continuously engage people as to the processes of vaccination. But at the end of the day, when we meet, we will look at all the activities that are being undertaken and be able to redirect, refocus, and try to get our people to do what they ought to do. So basically, I think I've answered all the questions, but to continue to appeal to Nigerians that we are still not out of the woods, urge people to get vaccinated. By my expectation, by now we should have vaccinated about 2 million people. But you can see that we are still not there. We are still below 1 million. So when I hear people talk about the fact that about supply, finish the one that we have now. We brought it, and we've sent it to all the states. Finish them. So the question of, lack of assurance of subsequent supplies should not even arise, because we are doing everything as a government to ensure that through the processes that have been fixed and through bilateral engagements and using some Nigerians that are out there on the international platform to help us negotiate and push for these vaccines. It's not a thing that we take lightly, because we know that by the time it is time to vaccinate people, we must make sure that the vaccines are around. I'll take this opportunity to thank our friends from the Indian High Commission for this generous donation. 100,000 doses of vaccines is not a small quantity. As a matter of fact, this is what a lot of African countries got through the distribution of the COVAX facility. Some didn't get as much as 50,000. 50,000. We got 100,000 from the people and the government of India. We are quite, we cannot but express deep gratitude for that. And I want to take the opportunity that you extend that to the ambassador, and by extension to the people and government of India. Thank you, and have a very good evening.
Thank you immensely.
Ministers here, members of the PTF, our guests, the acting Indian High Commissioner to Nigeria and his entourage, our brothers and sisters in the media, gentlemen and ladies, good evening, everybody. The chairman has said it all. we cannot but thank him for the service he and his team, the members of the PTF, have actually done to this country. As a matter of fact, somebody was telling me yesterday that this man, Boss Mustafa, and his team has saved this country from a major health calamity. And I concurred, and that is a reality. So, sir, we want to thank you so much for these efforts. But remember that they say that the reward for hard work is more work. So wait for more work. I want to appreciate everybody and to ask you to continue to be faithful with us. The media will let you know when next we'll be meeting. You'll be properly informed. And Nigerians will continue to believe that we will survive this pandemic. I want to, before I round up, to mention the last few words of the chairman in his speech. He said, be vigilant, stay safe, observe all public health measures, take responsibility, stand against vaccine hesitancy, stay away from fake news. As we round up today, I want to appreciate everybody and thank you and ask you to remember these last few words. And that's the only way we can keep and remain safe. God bless you all. Thank you.